All right, so Deputy President Paul Mashatile, as the chairperson of the South African National AIDS Council, is leading the commemoration of World AIDS Day from East London today. The theme for this year is Equal Rights, Equal Care. For more on this, let's cross to SABC News reporter Abongile Yankees, who's got the latest details for us there. A lot to reflect on, Abongile, in terms of the strides that have been made, but also some of the shortcomings. Quite a lot that we spoke about today pertaining to access to antiretrovirals and how many people who are still HIV positive that are not on treatment. Those are some of the issues that were expected to be dissected on today.
Well, a very good morning to you, Griselda, and to the viewers at home. We're coming to you from Tanzania, where the Deputy President of the country, Paul Mashatile, will lead the keynote address when it comes to World AIDS Day. Behind me, we do have the Treatment Action Campaign, people from that organization who are holding a picket here. They held a march earlier on, but now they've arrived outside the Sisatukashe Stadium, where they're expecting to get the attention of the Health Minister, Dr. Aaron Motsoaledi, and the Deputy President, Paul Mashatile. They are demanding that the issue of ARVs, that they should be issued in a 6-month period so that those who are living with HIV and AIDS can access them regularly. They are saying this short period of 2 months has a negative impact on them. But to tell us more, I'm joined by the General Secretary, Uput Aneleyawa. Sir, thanks a lot for your time. I see that you've come here to get the attention of the authorities. What's behind this?
The reason we are gathered here today is because we are here to hand over a memorandum to the Deputy President as the chairperson of the South African National AIDS Council, as well as the Minister of Health, Dr. Aaron Motsoaledi is the Minister of Health. Our call is one, is to say people living with HIV and who are stable on their treatment must be given 6 months supply of ARVs, as it is articulated on the antiretroviral clinical guidelines. We are asking the Deputy President and the Minister to use powers vested in them to put pressure and hold accountable provinces, districts, and the clinics which are not implementing this policy matter of giving stable people living with HIV 6 months supply of antiretroviral. Because we have seen in other African countries, they have started giving people 6 months supply of ARVs. What are the benefits of the 6 months? If you give someone who is stable on antiretroviral treatment 6 months supply, that person, you are reducing their number of visits to clinics. They know what they will go to the clinic only twice a year. But also it will address the question of congestion in our clinics of people who are just going there to collect treatment. But on top of that, it will be cost saving to our government, because you know that these companies which are packaging and dispatching medication, they won't have to do that on 2 months basis. They will do it twice a year. But also, above all, this is going to address the challenge the majority of public healthcare users are faced with, where when they go to our clinics, we realize that there is a dysfunction of the health system at clinic level, where majority of people decide to disengage from care because of staff attitude, long waiting hours, and the situation where sometimes there are no medicines. So it will curb this, but also as the country, as much as we've got about 7.8 million people living with HIV and 5.8 that are on treatment, we still have a challenge of more than 2 million people living with HIV who are not yet on treatment. So, as the country...
You allude that to accessibility of these ARVs?
Yes, one, it is around the accessibility and availability of ARVs, because if our government was able to purchase more ARVs, many people could have been on treatment. It's not like this, we do not know where is this 2 million. We know where they are, but the problem is they are not yet initiated on treatment. And we are saying all people living with HIV must be initiated on treatment, but those who are stable must be given 6 months supply in order for them to give way to those who are still initiated and those who are still on 3 months supply to be able to frequent after 3 months access to treatment. So it is against that reason we are marching today to call upon the Deputy President and the Minister to use powers vested in them to hold provinces, districts and clinics as to say why they are not starting to give stable people living with HIV and who are on treatment 6 months supply of treatment.
Let's talk about the availability of condoms throughout the country. How are we sitting there?
So, as a country, we still have some areas where you find out that, more especially in rural areas, where you find out that there is a challenge around accessibility of condoms and other preventative methods like your PrEP. And as the country, if you look 25 years ago, there was a political will and a political commitment where all political principles were talking, among other things, prevention. And when you go to hotels, you will find condoms there. But that, as the country, we have dropped the ball. So that's why we are saying, when we're talking about treatment to HIV, there are 3 components that we need to address. 1 is prevention, 2 is access to treatment, 3 is adherence to treatment. So if we want to prevent the new HIV infections, we need to make both internal and external condoms available. We need to make sure that there is access to PrEP so that if you test HIV negative, we know that immediately you're going to be initiated on PrEP so that we can reduce new HIV infections.
In this day and age, as we're commemorating this day of World AIDS Day, what are your other perceptions that you are finding on the ground with regards to HIV and AIDS?
The other perception which is on the ground, it is around men. There are a lot of men who are living with HIV. Some of them, they know their status. Some of them, they don't know their status. There is this perception that amadoda do not want to go to clinics because they've got their own myth. And it is against that background where we feel like we need to have more male clinics so that amadoda can be able to go to clinics, test, and know their HIV status. We cannot at this age and time where we find amadoda amaninzi, if his partner is testing negative, he thinks that he is also negative. But each and every person must be able to go and test, and in order for them to know their status so that they can be initiated on antiretroviral treatment as early as possible.
Lastly, before holding this picket, what other means have you been having to ensure that you engage government on this issue of the 6 months?
So, as TAC, we are working in more than 700 clinics in 8 provinces and in more than 42 districts. What we do on a daily basis, all TAC branches are going to clinics to monitor not only the HIV program but all healthcare services. So we have been engaging at clinic level and at community level, community members who are sharing their stories with us as to say why it is a benefit for them to be started on 6 months supply so that they can be able to adhere to treatment and get along with their lives, because at some stages people are missing their appointments of collecting treatment. When they go after a day or 2, they are being made to stand right at the back of the queue. They are being shouted at, and if they are given 6 months supply, they know that they will only have to go to the clinic twice a year. So it is against that reason we stand here to say those people living with HIV and who are stable on treatment, why do you delay them in terms of giving them 6 months supply?
Thank you so much for your time, so we shall catch up later on. Well, Crisella, that was Aneleyawa, the General Secretary of TAC. For now, let's head over for an ad break.